Here's a question I get asked more than almost anything else in my practice, but almost never in a direct way. What actually happens to your body when you're intimate or engage in self-pleasure every single day? Does it help you or does it hurt you? Does it change your energy, your hormones, or even your prostate health? And if you're over 60 and you've been quietly wondering this but never felt comfortable asking anyone, I'm glad you're here. Because today, I'm going to give you a clear, science-based answer without myths, without judgment, and without confusion. I'm Dr. Jocelyn, a urologist with over 12 years of experience helping men understand their bodies in a calm and practical way. And what I'm about to explain may genuinely change how you think about your own daily habits. Now, before we go further, take a moment and hit that like button. And if you're comfortable, drop a comment telling me where you're watching from. If you haven't subscribed yet, you may want to do that as well, because what we discuss here is something most men are never taught properly. Let's begin. Now, let's address something important right away. There is a lot of confusion around this topic. Some people believe that daily intimacy drains your energy and lowers testosterone. Others say it's necessary for prostate health and should be done frequently. So which one is correct? The truth is, neither extreme is fully accurate. Daily activity is not automatically good, and it is not automatically harmful. What actually matters is your individual health, your recovery capacity, and whether your habits are supporting your body or quietly pushing it beyond its limits. Now let me explain what is actually happening inside your body during these moments. When you engage in intimacy or self-pleasure, your brain activates a very complex chemical response. Dopamine is released, creating pleasure and motivation. Oxytocin increases, supporting relaxation and emotional connection. Endorphins rise, improving mood and reducing stress. Then, after climax, prolactin increases, which brings that calm, satisfied state and temporarily reduces sexual drive. At the same time, your cardiovascular system becomes mildly active. Your heart rate increases, blood flow changes, and your pelvic muscles contract rhythmically. Your prostate also releases stored fluid. And shortly after, your body enters a recovery phase, where hormones rebalance and systems return to baseline. For most healthy men, this is not harmful at all. In fact, it can support stress reduction, improve circulation, and even contribute to better sleep quality. But here is where things become more nuanced. If you are engaging every single day and you start noticing fatigue, reduced interest, difficulty reaching satisfaction, or physical discomfort, these are not random symptoms. They are signals. Not that something is wrong with you, but that your body may need more recovery time between sessions. Because your nervous system, your hormones, and your tissues all require time to reset properly. And this is where most men miss the key point. There is no universal rule that applies to everyone, only patterns and feedback from your own body. Let me share something that happened recently in my clinic. A man in his mid-60s came to see me. He was slightly hesitant, but he finally asked a very honest question. Doctor, I've been intimate with my wife almost every day for years, but lately I feel more tired. Could this be the reason? I asked him a simple follow-up. How do you feel immediately afterward? He said, relaxed, calm, and emotionally close to his wife. Then I asked, how do you feel the next morning? He paused and then said something important. Actually, pretty good, even energized. At that point, the picture became clearer. His fatigue was not coming from intimacy itself. It was coming from other areas, like sleep quality, hydration, and dietary habits. His body was actually handling daily activity very well. In fact, in his case, it was one of the healthier parts of his routine. But I've also seen the opposite situation. Men who engage daily and slowly begin to feel drained, irritable, or disconnected from the experience. For them, reducing frequency slightly to every other day or a few times a week completely changes how they feel. More energy, better satisfaction, and improved balance overall. So again, There is no single answer that fits everyone, but there are patterns you can recognize. There are warning signs you should not ignore, and there are adjustments that can significantly improve how your body responds. And that brings us to the important part of today's discussion. The 5 most common mistakes men over 60 make when it comes to frequency, recovery, and maintaining vitality in this area of life. Let's begin with the first one. Mistake number 5, not recognizing the difference between physical desire and habitual behavior. Mistake number 5 is something subtle, but extremely important, and it often develops slowly over time without men even noticing it. It is not about frequency itself, and it is not about whether daily activity is too much or too little. It is about the difference between true physical desire and habitual behavior. Now, this distinction is more important than most people realize, especially after 60, because over time, the body and mind can start blending routine with genuine need, and that can change the entire experience. Let me explain it in a simple way. True desire comes from within the body naturally. It is influenced by your hormone levels, your stress levels, your emotional state, and your overall energy. When it is real, it feels spontaneous, it feels natural, and it often improves your mood afterward in a noticeable way. There is a sense of satisfaction that feels complete, not forced. But habitual behavior is different. Habitual behavior is when the action is repeated so often, or at the same time, or under the same conditions, that it becomes automatic. It may be triggered by boredom, stress, routine timing, or simply long-term repetition. And there is nothing wrong with either pattern from a moral or personal standpoint. However, medically speaking, the difference becomes very important. Because when something becomes purely habitual, your brain does not always respond the same way anymore. The dopamine system, which is responsible for motivation and reward, can gradually become less sensitive to repeated stimulation. That means the same activity may not produce the same level of satisfaction or emotional response as before. Over time, some men describe this as doing it, but not feeling the same way anymore. Not because something is wrong with the body, but because the reward system has adapted. And when that happens, a few changes may appear. Reduced pleasure, lower motivation, or a sense that the experience feels mechanical instead of natural. So what do we do with this information? The solution is not to eliminate the behavior. The solution is to reintroduce awareness into it. Ask yourself a simple question before engaging. Is this coming from genuine desire, or is this just part of my routine? If the answer is routine, then the goal is not restriction, but reset. Sometimes even a short break of a few days can help restore sensitivity in the system. Not as punishment, but as recovery. And many men are surprised to find that after a short pause, natural desire returns more strongly, and the experience feels more meaningful again. Now, let's move to the next important point. Mistake number 4 is often completely overlooked, yet it directly affects energy levels and daily well-being. It is the failure to understand how intimacy interacts with your cardiovascular system and overall energy reserves. This is something many men assume is unrelated, but in reality, it is closely connected. Because every time you engage in intimacy or self-pleasure, your body is not passive. Your heart rate increases, your blood pressure rises temporarily, your muscles activate, and your nervous system becomes more alert. From a physiological standpoint, this is similar to mild physical exertion. For a healthy man with good cardiovascular fitness, this is usually well tolerated and can even act like a small form of exercise that supports circulation. But the situation changes when recovery capacity is reduced. If your sleep is poor, your nutrition is weak, your hydration is low, or your heart health is not optimal, then the same activity can feel more draining than energizing. And this is where many men over 60 start to notice differences they did not feel in earlier years. Because aging naturally changes one important factor: recovery speed. The body does not bounce back as quickly as it once did. Not because it is failing, but because biological repair processes slow slightly with age. So when energy demand increases without enough recovery support, fatigue becomes more noticeable. Let me make this very practical. Inside your cells, you have structures called mitochondria. These are responsible for producing energy. They require oxygen, nutrients, and rest cycles to function efficiently. If your body is repeatedly asked to perform without adequate recovery, mitochondrial efficiency drops and you feel that as tiredness or low energy. So what should you focus on? First, nutrition matters more than most people think. Protein supports tissue repair, healthy fats support hormone balance, and complex carbohydrates provide steady energy. Second, sleep is not optional here. Most hormonal restoration and cellular recovery happens during deep sleep cycles. Without it, your body never fully resets. Third, hydration is often underestimated. Even mild dehydration can reduce energy efficiency and increase fatigue after physical activity. And fourth, frequency matters individually. If daily activity leaves you feeling consistently drained, then spacing it out to every other day may allow your system to recover more fully. Not because daily activity is harmful, but because your body may simply need more time between sessions. And when recovery improves, energy usually improves with it. Now, before we move further, the next point becomes even more specific because it involves one of the most important organs in men's health after 60, the prostate. And misunderstanding this is where many men begin to make mistakes without realizing it. But we will go into that carefully in the next part. Now let's talk about something that becomes increasingly important with age, the prostate gland. And this is where a lot of mixed information exists, which often leads to confusion rather than clarity. You may have heard that regular intimate activity is good for prostate health. And in general, that statement has some truth to it, because regular emptying of the prostate can help reduce fluid buildup, improve circulation in the gland, and may lower the risk of certain types of congestion or inflammation over time. But what most men are never told is this: frequency alone is not the full story. The prostate does not respond only to how often. It also responds to how, and more importantly, how your body reacts afterward. Let me explain. The prostate is a small gland that produces fluid, which becomes part of the semen during intimacy. Each time you engage in sexual activity or self-pleasure, this gland becomes active, produces fluid, and then empties. In a healthy system, this cycle is smooth and balanced. But when frequency becomes very high, especially daily, without sufficient recovery, the gland may not always have enough time to fully reset. And when that happens, some men begin to notice subtle changes: increased urgency to urinate, mild discomfort in the pelvic area, or a feeling that the bladder is not fully relaxed. These are not immediate danger signs, but they are signals of irritation or overstimulation. On the other hand, going too long without any activity can also create a different problem. Fluid can remain in the gland for extended periods, which may contribute to a feeling of congestion or mild inflammation in some cases. So the goal is not maximum frequency and not complete avoidance. It is balance. For many men over 60, a moderate range of activity, typically around 2 to 4 times per week, tends to support a healthier rhythm for the prostate. Not as a strict rule, but as a general physiological guideline based on how the gland responds to repeated use and recovery cycles. However, and this is very important, your individual symptoms matter more than any general number. If you notice discomfort, pressure, changes in urination, or irritation after daily activity, that is your body giving feedback. And adjusting frequency slightly can often improve those symptoms significantly. Now let's move deeper into another layer of function that is often completely ignored in discussions about male health. The pelvic floor muscles. Most men never think about them until something starts to feel different. But these muscles play a central role in both urinary control and sexual function, and they are directly affected by frequency and recovery. Each time you engage in intimacy or self-pleasure, these muscles contract repeatedly. They support the bladder, help control flow, and coordinate physical response during climax. When used occasionally, they stay strong and responsive. But when used very frequently without enough rest, they can begin to develop fatigue. And muscle fatigue in this area does not always feel obvious at first. Some men notice weaker sensation, reduced control, or mild discomfort after activity. Others notice changes in urinary patterns, like urgency or difficulty fully relaxing. And this is where many misunderstand the cause. They assume it is aging alone, but in reality, it is often a combination of age-related changes and muscle recovery imbalance. Because just like any other muscle in your body, the pelvic floor needs recovery time. When it does not get that time, two things can happen. Either the muscles become too tight or they become too weak. Tight muscles do not relax properly, which can create discomfort or pressure. Weak muscles do not contract effectively, which can reduce control and sensitivity. So what is the solution? First, if you are engaging daily and noticing any of these changes, the simplest adjustment is recovery spacing. Even moving from daily activity to every other day can significantly reduce muscle fatigue. Second, targeted pelvic floor exercises can help restore strength and coordination. You may have heard of Kegel exercises, and although many men ignore them, they are clinically useful when done correctly. Here is the basic method. You gently contract the same muscles you would use to stop urine flow. Hold for about 5 seconds, then release fully for 5 seconds. Repeat this around 10 times, twice per day. Over time, this improves strength, control, and recovery capacity. And third, if symptoms persist, such as ongoing discomfort or urinary changes, a pelvic floor specialist can provide targeted therapy. Because this is not something you simply live with. It is something that can often be improved with the right approach. Now that we understand how the prostate and pelvic muscles respond to frequency, we need to address something even more important than physiology. Something that silently influences behavior, decision-making, and even health outcomes. And that is mindset. Because the biggest mistake many men make is not physical. It is emotional. And we will explore that in the next part. Now we come to something that is often more powerful than hormones, more influential than frequency, and more damaging when ignored. Your mindset. Because in my experience working with men over 60, the biggest issue is not physical capability. It is emotional pressure, built-up beliefs, and silent shame around intimacy. Many men grow up with messages that are never directly spoken, but deeply absorbed over time. That intimacy should become less important with age. That desire after a certain age is inappropriate, or that needing physical connection somehow reflects weakness or lack of control. And over time, these beliefs do not just stay in the background. They shape behavior, they influence confidence, and they directly affect how the body responds. Because the mind and body are not separate systems in this area. They are deeply connected. When a man feels shame or guilt around intimacy, his body responds with stress. And stress changes hormone balance, particularly testosterone and cortisol. It also affects mood, sleep quality, and even physical performance. So what looks like a physical issue is often partly emotional in origin. Now let me be very clear here. There is nothing medically wrong with desire at any age. There is nothing abnormal about wanting connection, pleasure, or intimacy in your 60s, 70s, or beyond. And there is absolutely no biological expiration date on this part of human life. What changes is not the legitimacy of desire, but the way the body processes it over time, and how well it is supported by health habits, emotional state, and recovery capacity. The problem begins when men start suppressing or judging themselves for natural feelings. That internal conflict creates chronic stress. And chronic stress has very real physical effects. It can reduce energy levels. It can disrupt sleep. It can lower libido. And in some cases, it can even contribute to sexual dysfunction. Not because the body is failing, but because the nervous system is under pressure. So what is the healthier approach? It starts with removing judgment. Not everything needs to be labeled as too much or not enough. Instead, the focus should be on whether your habits are helping or harming your overall well-being. If daily activity makes you feel good, leaves you relaxed, and does not create physical discomfort, there is no medical requirement to stop. If less frequent activity feels better for your body, that is also completely valid. There is no universal standard you are supposed to match, only your own body's feedback. And this is where many men begin to experience improvement, not from changing behavior first, but from changing interpretation. When shame decreases, stress decreases. When stress decreases, hormones stabilize. And when hormones stabilize, natural function often improves. Now, let's bring this into something practical, because understanding is not enough unless it leads to action. If you want to evaluate whether your current frequency is working for you, you need to observe your body over time, not just in the moment, but in patterns. How do you feel immediately afterward? How is your energy the next day? Is your mood stable or fluctuating? Do you feel physically comfortable, or are there subtle changes like fatigue or tension? These answers matter more than assumptions, because your body is already giving you feedback. You just need to pay attention to it. And if adjustments are needed, they do not need to be extreme. Small changes often make the biggest difference. Spacing activity slightly, improving sleep quality, staying hydrated, supporting nutrition. These are simple but powerful corrections. And now we move into the final stage of this discussion, where everything we have talked about becomes practical, structured, and actionable. Because knowing what is happening is important. But knowing what to do next is what actually changes outcomes. And that is exactly what we will cover in the final part. Now, let's turn everything we've discussed into something practical, something you can actually use starting today. Because understanding your body is only the first step. The real improvement happens when you start responding to what your body is telling you, instead of guessing or following rigid rules. So here is your clear action plan. Step 1. Observe your body for the next 2 weeks. Do not change anything immediately. Simply pay attention. After intimate activity, notice your energy level, your mood, and your physical comfort. The next morning, observe whether you feel rested, neutral, or drained. Also pay attention to urinary patterns, sleep quality, and general motivation. These small signals will tell you more than any external advice, because your body already knows the answer. Step 2. Identify your personal optimal frequency. If you notice that daily activity leaves you feeling consistently fatigued, then try spacing it out. Every other day is often a good starting point. If you feel strong, energized, and balanced with daily activity, then there is no medical need to change it. The goal is not restriction. The goal is alignment. Step 3. Support your recovery systems. Your body does not operate in isolation. It depends on sleep, nutrition, and hydration. Make sure you are getting enough protein to support tissue repair. Include healthy fats for hormone balance. And eat complex carbohydrates for steady energy. Drink enough water throughout the day, not just when you feel thirsty. And most importantly, prioritize sleep. Because most hormonal regulation and physical recovery happens during deep sleep cycles. Without that foundation, everything else becomes harder. Step 4. Strengthen your pelvic floor muscles. These muscles are often ignored, but they play a central role in both urinary control and sexual function. Start simple. Contract the muscles you would use to stop urination. Hold for 5 seconds, then release for 5 seconds. Repeat this 10 times, twice a day. Consistency matters more than intensity here. Within a few weeks, many men notice better control, improved sensation, and reduced discomfort. Step 5. Release unnecessary shame. This is one of the most important steps, even though it is not physical. If you are carrying guilt, embarrassment, or outdated beliefs about intimacy, it affects everything else. Your hormones, your stress levels, your relationships, and even your physical health. Talk about it if needed, with a partner, with a doctor, or with a therapist. But do not let silence turn into internal pressure, because there is nothing abnormal about your needs, and nothing to be ashamed of in wanting connection and well-being at any age. Now, I want you to understand something clearly. If you have been struggling with questions about frequency, desire, or function, you are not alone, and you are certainly not broken. What you are experiencing is a normal part of aging and human biology. and it can be managed, improved, and optimized with the right understanding. I have seen countless men who believed their intimate life was over, men who thought decline was inevitable, men who assumed nothing could be done. And yet, with small adjustments, better habits, and a shift in perspective, they regained confidence, comfort, and in many cases, enjoyment of this part of life again. And that is important to remember. Your age does not define your vitality. Your past does not limit your future. And your current symptoms are not permanent sentences. They are signals that can be understood and responded to. So, as we close this conversation, I want you to take one simple step. Pause for a moment and reflect honestly on how your body has been feeling. Not with judgment, but with awareness. Because that awareness is where change begins. If this helped you understand something clearly, take it as a reminder that your body is not working against you. It is communicating with you. And when you start listening properly, everything becomes easier to manage. Before you go, if this video gave you value, feel free to like it, leave a comment, and let me know where you are watching from. And if you want more clear, judgment-free medical explanations like this, make sure you are subscribed. I'm Dr. Jocelyn, and I want you to remember this one thing. Your best years are not behind you. They are shaped by the choices you make today. Take care of yourself.